Higgins.
Thank you, Mr Speaker. Well, I disagree actually with the member opposition on his comments about major reform required for our health system, because we've just been through quite an incredible COVID crisis. And if you look around the world, who is doing the best? Australia. Why is that? We have one of the best healthcare systems in the world. And I would say that as an Australian, and as all Australians, should be very, very proud of our healthcare system. Now, to the average punter, Mr Speaker, the medical benefits schedule, otherwise known to most of us in the medical system as the MBS, would appear to be a boring administrative instrument. However, as someone who really cares about health, I would say that there's nothing further from the truth. The recent COVID-19 pandemic has taught us that it is anything but a boring administrative instrument. Indeed, the MBS is a key component of our broader Medicare system. This bill brings the law into line with practice and reduces the unnecessary administrative work in relation to the MBS. That's good news for patients and it's good news for practitioners. So, Mr Speaker, I'd like to take the opportunity to reaffirm the Morrison government's commitment to Medicare and the health of Australians more broadly. It's a fact that is rock solid. The total cost of all Medicare services in 2018-2019 was $24 billion. This is not a small piece of legislation, a small piece of policy. This is a centrepiece of the Morrison government, and there's been an increase of 3.5% in benefits paid from the previous year. Most importantly, for those who may be struggling to pay for their healthcare costs, and you'll see in the US and in the UK, where I have many colleagues, I know personally of people who struggle to even get a test for COVID in the US because of the inordinately high cost of things like COVID testing, up to $1,000 in the private healthcare system in the US. While here in Australia, we have an ability to access low-cost healthcare. GP bulk billing rates, which are a centrepiece of that low-cost healthcare under Medicare, hit a record high of 86.2% for the full year of 2018 to 2019. Patients made some 136 million bulk billed GP visits. That's up more than 3 million on the previous financial year. So Australians are enthusiastically supporting bulk billing. The bulk billing rate for total Medicare services reached 79% for 2018 to 2019, up 0.2% compared to the previous year, and up 2.7% from 76% in 2012 to 2013. Now, Mr Speaker, the benefits for patients are clear. Australians accessed 335 million bulk billed services, including GP, specialist, pathology and diagnostic imaging services in 2018-2019. That's up 8.9 million more than the record set last year. The great thing is Australians are getting bang for their buck, medically speaking. When it comes to healthcare, we know that the Australian healthcare expenditure to GDP is amongst the best in the world. So for a middle-order power with an outstanding healthcare system, our healthcare expenditure to GDP was 9.6%. This is lower than the UK, which is 9.7%, Canada, which is 10.6%, and the USA, which is a whopping 17.2%. Now, Mr Speaker, I have worked in the UK and the US system, and I know what I'm saying when Australia takes a back seat to no one with regards to healthcare and public healthcare. We know that, the government know that, and most importantly, the Australian taxpayer knows that, Mr Speaker. These figures show that Medicare is supporting the health and well-being of Australians more than ever before. And this has only been possible by the Morrison government's continuing and increasing investment in Medicare. Now, Mr Speaker, the MBS is central to our Medicare system. It lists a range of professional services and allocates a unique item number to each service, along with a description of the service. In broad terms, the types of services on the MBS include consultation, diagnostics, therapeutics and procedural services. It could be said that the MBS is analogous to the pharmaceutical benefit schemes, which lists the medicines available to be dispensed to patients at government-subsidised prices. However, this lists the health services rather than medicines. On the 1st of July this year, the government increased the patient rebate for further GP items on the MBS specialist procedures, allied health services and other GP services such as mental health and after-hours services, which were all indexed. Now, Mr Speaker, I would like to take the opportunity to talk about a very important aspect of the MBS, and that is the telehealth. The MBS has been a vehicle for the rapid expansion of telehealth services during the COVID-19 pandemic, and this has been a lifeline to patients, But importantly, it's kept our practitioners off the front line. Now, this has been important, particularly when we were dealing with a crisis and shortage of PPE, that's masks and gowns, equipment across Australia, and indeed, Mr Speaker, across the world. And the telehealth item number was incredibly important for specialists, GPs and allied health practitioners. Indeed, many practitioners from right around the country contacted me to say we are concerned about our ability to provide services to our patients through COVID. So you can imagine, Mr Speaker, their absolute delight about the increase in the use of telehealth. Early on during the crisis, the Morrison government undertook an expansion of telehealth services that would have otherwise taken 10 years. As the Minister for Health, Greg Hunt, has said, it was achieved in just 10 days. And this helped reduce the risk of community transmission of COVID-19, and it was a very important new MBS item number that was introduced. During this period, Australians took up this new service with exceptional alacrity. 110,000 telehealth consultations were provided by GP, specialist and allied health professionals, and a whopping 1.1 million phone consultations provided by GP, specialist and allied health professionals. The uptake of this COVID temporary telehealth item was most pronounced for GPs, with, in March, 7.5% of GPs visits provided via telephone or telehealth. We also doubled the bulk billing incentives to support these critical services because of the health crisis that has been COVID. History shows that in the time of crisis, innovation flourishes, and the expansion of telehealth is indeed indicative of this, Mr Speaker. And I hope to see that these services will become a legacy piece of the COVID-19 pandemic, and in fact the Minister for Health has committed to funding these now and into the future. Mr Speaker, it's important that these sorts of reforms, where we've responded to the crisis using innovation, we've responded swiftly in a meaningful way for the taxpayers of Australia, and they have told us that is what they want. Mr Speaker, instead of having to travel for hundreds of kilometres to seek medical care, patients now can pick up a phone. Instead of having to sit through hours of congested traffic or take time off work, patients can now access their GP or specialist with so much more higher productivity and so much ease of access. Mr Speaker, what does this all add up to? Well, Medicare is the jewel in the crown of our healthcare system. We must protect this and always be striving to improve it, and this is exactly what this bill today does. What it does as a primary purpose is to remove the annual sunset period for the regulations which prescribe the table of medical diagnostic imaging and pathology services covered by the MBS. These regulations provide the legal basis for the $26 billion in Medicare benefits paid each year. So this is no small thing that needs to be assessed. The current imposition of the sunset clause means that regulations pertaining to the MBS currently need to be remade every year. This is not very practical. The benefit of this change that is being discussed or put forward in this bill is twofold. First, it reduces the onerous and complex administrative work involved in annually remaking the regulations pertaining to MBS items, and secondly, it mitigates the risk that an error during the remake process could affect patient entitlements to benefits under Medicare. Mr Speaker, cutting this red tape means Australians have clarity and certainty of items listed on the MBS. The bill also makes several small but redundant provisions in the Act, changes to several small but redundant provisions in the Act, which are no longer required. This includes removing references to the establishment and operation of the Medicare Benefits Advisory Committee, which has been active for more than 20 years and has been replaced by the MBS Review Committee. It removes calculations relating to Medicare benefits which are no longer used. It also removes references to historical requirements for optometrists, which were removed in 2016 to reflect modern administrative arrangements. And it removes Section 18, which formerly dealt with the repayment of Medicare benefits where a person receives compensation or damages for an injury that incurs medical expenses. And finally, it removes the now defunct Section 10C, which required the Minister to establish an independent review of the extended Medicare safety net benefit capping arrangements. Mr Deputy Speaker, in conclusion, ensuring Australians have access to Medicare services that are effective and appropriate for patients now and into the future is a key priority of this government. I'm proud to be a part of a government that guarantees patient entitlements under Medicare whilst cutting red tape, ensuring that the law is in line with modern practices. This can only be a good thing for health outcomes. Mr Speaker, this bill builds on the Morrison government's commitment to supporting the health and well-being of all Australians. We should be proud to be Australians. We should be proud of how we have addressed the COVID crisis together. You should be proud of a Morrison government that is committed to the health and well-being of all Australians. Thank you, Mr Speaker.